Well, nearly 3 years into the COVID-19 pandemic, the demand for mental health treatment continues to rise, and remote therapy has become a real go-to lifeline for many.
It allows for patients to have more flexibility, but does advertisement of online therapy across digital platforms impact the quality of care?
And the new year is a time when many tend to make mental health and well-being a priority. Joining us, Chantal Abbas, a licensed mental health counselor. It's so good to have you back in the studio.
Thank you. It's good to be here.
Yeah, it's good to see you. And, we've talked about this many times, this surge of, more interest in mental health, but also a crisis in the shortage of therapists and counselors available. What do you make of that? I mean, there's a big shift happening.
Well, I think there's always been a need for mental health, but more and more people are aware of it now. And definitely the surge during COVID, March to August of 2021, there was a huge need because people were stuck at home, lacked interaction with others, and really felt isolated. So there was a lot more availability for mental health services due to the online resources. The therapists were still there and available, but they're actually able to cross over states with their license in different situations, and it made it easier for the public. So I think that was a great thing during that time.
I feel like every time I scroll through social media, maybe this is just my algorithm, there are all sorts of advertisements for online therapy and even online medication. Just do a quick visit with a provider online. What do you need to be looking for if you are clicking on those social media links, and what is the danger there?
I think there's a big danger there because unfortunately large companies can capitalize on this, and sometimes the quality goes out the window. I'm not saying that about all the therapists that are in these large organizations, but even therapists that are in a group practice where there's a lot going on, sometimes the quality can get watered down, or they might get linked with the wrong therapist. So I think it's very good to do some research first, Google searching, therapy online, you can look them up. You can find out, what kind of things are you looking for specifically based on your insurance. I would be careful with certain of these large companies just because, especially if you're dealing with some chronic mental health issues, I think it really is best to first meet, at least first in person, with a therapist. Our job is to diagnose, assess, and treat, and doing that can be difficult with someone virtually. People don't show all of themselves behind a screen. You just don't. And so we need to be, I think, at least one time in person to get to know the therapist and develop that relationship.
I mean, is it almost like improper therapy? Would you call that? I mean, how can you just, if you're in the moment and you're feeling maybe that there's some kind of disconnect, I mean, what are kind of some of those warning signs, those red flags that you're having kind of that improper therapy?
Well, I think just a lack of connection in general. Part of our job is to link people with people they feel comfortable with. We never capitalize on, I want all the clients. If you don't feel comfortable, please go somewhere else. Our job is to make sure your mental wellness is most important. So I think sometimes it's hard for people who are very shy or withdrawn or have a difficult time expressing themselves to actually get out there and talk when they're behind a camera. I've had people that are like that come in and say, I tried online and I couldn't connect at all. Because sometimes we're in a space and it's quiet and they're processing. There's something to be said for being in a safe space, away from home, away from noise. I've done online and had people that were hiding in the bathroom or in the closet because they're afraid someone's going to hear. So the whole ambiance behind what we do, I feel like it has to do with an interpersonal relationship, and that has a lot to do with being present. I'm not trying to diss online therapy. I think it has its place, but I think we definitely don't want to let go in person.
I'm really concerned about the costs involved. Some people may not have good health insurance or insurance at all. And many times, depending on the care level that's recommended, it may be several visits per month, and that really adds up. And again, the shortage of counselors and therapists out there. So what do you encourage people to do if they're facing some of those challenges?
Well, first of all, to contact their insurance company if they have an insurance plan. Find out if they have EAP services, employee assisted program. Those can offer free therapy services for a limited period of time. If they're unemployed or they don't have insurance, there are also community groups that offer free counseling. Within Orlando, a lot of times the schools have social workers and people that can help link services for kids. So they are out there. It's just finding them and knowing who to ask.
And when do you know if you need to seek professional help?
I think when your daily functioning is not what your norm is, when you feel like your mental health is getting in the way of your lifestyle and it's affecting your relationships with other people, it's really important just to reach out and talk to somebody.
And starting that conversation is just that's the hardest part, is that reaching out and it's taking that time. So thank you so
Absolutely.
much for breaking it all down for us. We appreciate it.
Thanks for having me.
Of course.